And one of the sub areas of preemptive cybersecurity is automated asset exposure management. And so it's like proactively understanding what your assets are and what exposure they have and mitigating that in advance, right? And that's site deploy all day, right? Understanding your assets, here's your inventorying, here's your boundary, and we also have it so that we can point out like the vulnerabilities, the issues, right? And so there's a trend towards that, where a lot of these traditional detection and response tools are going to be displaced by this preemptive cybersecurity.
You mentioned talking about the VP and getting above the VP. I think that's where someone like Brendan, who has a lot of experience in sales, really knows how to navigate those waters, can help you like bust through. Right. Sounds like you have a really good as to getting in. You have a good product. IT teams are loving it, which is great. And I think that's where, having someone who's really skilled to talk to those VPs and explain the value in terms that they understand and really makes them comfortable with making those decisions, I think is where it moves a lot faster. You're right
Yeah.
on a lot of things as far as, the breaches. There's so many today that people think it's just, another thing and is inevitable. I came up with this marketing idea for healthcare. And I think that one of the things people don't realize is, right, in healthcare, it's like your patient records got breached. Yeah, just another thing, right? From the patient perspective. But if you
Yeah.
start digging into really explaining what that means, what patient records
Yeah.
got breached, like, let's say you had a sexually transmitted disease, or if you
Yeah.
had breast surgery, or like,
Yep.
your x-rays were being shown. That's different than saying your health data is breached, right? And that's, so it's
Yeah.
really like informing, so patients, when they hear that, they're like, whoa, 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 wait a minute,
Whoa, whoa, whoa,
this is a
whoa.
little bit
Exactly.
different, right? So I
Yes.
think that's one
Yes.
of the marketing things. I think that's one of the marketing strategies that are different.